You need to speak in the mic.
Okay. Can you all hear me? Can anyone from the online audience respond?
Yes. Yes.
Okay, we're good to go. Before we talk, we begin the session, I would, with the limited delegates who are here, I would want to understand how many of you have ever done a qualitative research.
Email ID.
Anyone who's interested to take a qualitative research? Or, yeah. Okay. So going to the next slide. Basically, this whole session is going to be, I'm not going to take long, and since it's been a very long day, I'll try to make my presentation as brief as possible, touching on, what kinds of questions are when we actually go for a qualitative design, and what are the methods which are involved, which methods as a qualitative researcher we would want to take. Brief steps about the different methods, and then going into how the trustworthiness of a qualitative research can be ensured. Okay. Now, we have to just go back. I know the problem is also probably the wide range of audience that we have today in terms of those who are doing basic research, those with the socio-behavioral, epidemiological, community-based clinicians, things like that. So this is basically focused towards people who would like to take up socio-behavioral research or improve their interventions, if any, if they have, or clinical research. So your question on which methodology you would choose on a quantitative or a qualitative would depend upon your research objective, your aim, your goal, what you basically want to do. So how much literature exists on that particular topic and what you want to add on, or is there nothing which is available which you really want to explore about why people behave in a different, in a particular manner? What are their opinions? What are their perspectives? Or what is it helpful to understand those? Maybe it is, because many times getting just about how much, what may not be so much insightful, and maybe we need to move beyond. So in those cases, we might want to take up a methodology which would try to address those. And also, of course, as a researcher, while we do some research, we also look at the timelines which are available for us. How early, how soon, how quick we need to be getting back with the results. And how much resource is available. That is also an important factor. Because if we want to plan something very big, we need to be thinking about the budget we have. Additionally, what skills as researchers we have. Randomly, we can't, because we know that there is a quantitative method which is available, we don't quick jump and then go, take that method up. And similarly, for a qualitative research, it's not that everyone thinks it easy and can do it. It requires a lot of training, because we are understanding perspectives from people in a deeper, in depth. So that requires training in terms of understanding, eliciting information. Not alone that, also in terms of analysis. We need to be thinking. The researcher has to be. It's a little different way of thinking at all when we think about undertaking a qualitative research. It's just not the change of methodology, but also in terms of the shift in thought that has to take place. While doing quantitative, probably we are thinking about something which is tangible, which can be observed, which we are thinking is a hypothesis which we want to prove. But in terms of qualitative, we are actually trying to assess and come to a conclusion based on our data to find something which is not known, or maybe explore in depth about why and how people are behaving in a particular manner. Now, when do we go for a qualitative research? I'm not going into the quantitative, but just to give you an idea about when we actually go for it. So when something is not very much known, so we want to explore and understand. When something is known, but then we only know about what is happening, how much is the percentage, but we want to understand about why such things are happening. If people behave in a particular manner, we have a rationale for that. If they're not taking medicine, then they're not taking medicine just because it is probably inhibiting their activity. That's the reason why they're not taking. So it's about not just not telling them that, go for this medication, that need to make them understand that these behaviors are required to be changed so that your health, which is important, will be in proper shape or whatever is the research topic. And then, talking about the quantitative methods, we have structured tools. I'm sure this is spoken in the earlier session. And we have coded, we have the answers, the responses are right there. But when we're talking about the level of qualitative information, we're talking about flexibility which is available. So that the researcher can make those open or go with an open-ended questionnaire and elicit information and not go according to what the researcher wants. So it is a bit, naturalistic, as we say. It takes place in a location and according to the control of the situation is not with the researcher but with the respondent, where we are trying to assess the situation from the respondent. And here, of course, in cases of sensitive topics, I know about the research, when the call for proposal is made for areas in particular, HIV, or maybe ICMR,
you are requested to kindly consider the online listeners. Please do not murmur in between.
Sorry, okay, so it's a little hard. I'm on the mic and I'm trying not to move away from the mic.
Ma'am, not you. Ma'am, the other people are murmuring, not you. I'm not saying addressing to the speaker, but other people are murmuring.
Okay, I'm not sure. I mean, the mics are off, I guess.
Yeah. Like you move it away from you. Yeah.
Do you still continue to hear voices and noises in the background? Okay, I'm continuing with my presentation. Okay, and also about, here the intention is not to come up with generalized, you don't want to generalize the findings which are coming out of your research. Here you want to, as I mentioned earlier, delve deep into the issue and understand why something is working, not working, or the perspectives of the participants, in terms of why certain behaviors they take certain things or they behave in a particular manner. Understand their opinions, the meaning they attach to what they do. That is the goal of having a qualitative study. Now, in the case of in public health, we have many instances, and I'm sure there are people who have already conducted qualitative research and would be familiar with what the kinds of topics are. So they could be in terms of understanding the underlying attitudes, behavior, the perception, the stigma associated with, sometimes people don't want to reveal those when you ask them in a structured manner. You may want to go and then ask them in a confidential manner and then just listen to their story, hear them speak, and then assess what the situations are. In some cases, we may want to assess how the group functions. We know that we have an intervention. We want to understand the accessibility of the intervention, the feasibility of the intervention. We want to try and test the development of the intervention that we have made. We want to see how it works or not. In those cases, qualitative may be the best. So, why people plan of these or conduct plan of studies, they may want to keep in mind the qualitative research, the ideas, what needs to be, which are the questions that we need to be addressing. Now, understanding about, what are the barriers, what are the facilitators of the barriers and facilitators of, say, for example, accessing health facilities or immunization. Could be, that means further exploration, not just through the structured questionnaire, but going beyond and collecting information, maybe observing how things are happening in the field, or maybe collecting information through the focus group discussions, understanding the perspectives of both the respondent or the healthcare provider, the different stakeholders who are available. That may be helpful. That would help us in improving the program as well. So it is important what the the qualitative research gives, it gives you the context. It just doesn't give you why or what is happening. So it also gives you an explanation. It describes what is happening for the the research question that is being explored. Now, I will quickly go through these because I'm sure these are certain things are core and then do remain the same in quantitative as well as qualitative, except for the fact that the question of inquiry is a little different here. So identification of the research topic is according to what we want to. That's what we will be discussing now, and then stating the purpose, coming out with the literature, and coming up with a conceptual framework. About what is the inquiry, what is it that we are trying to assess, and then seeing that what are the domains that are actually influencing. Say, for example, we are going to assess maternal healthcare utilization. So we know that there are individual level factors, there are community level factors, there are factors at the societal level that may influence the utilization, the uptake of the utilization of or the health services. And then we want to understand in terms of so that we know, and that is how that will guide us in terms of what our tools will be, who our participants will be, which will be our area of research, how much will be our response, who all should we be interviewing, those things. So we have this conceptual framework and we have that knowledge that will guide us in not only the tool development but for the entire the study. And then what framework are we going to use for analysis will also be decided upon with the help of the conceptual framework. Now, we need to be having, of course, the specific aims and objectives and also the research questions. So here the research questions are exploratory, so which, as I mentioned, there is little known and we want to go further on that. Or it could be something where we want to be explaining to things. So we know how much is the percentage of people who are using smokeless tobacco, for example, in Northeast. We know that there's a high use of smokeless tobacco. And now what and why does it use is something which we're not getting through the facts data, the information which is collected. So there we may want to go and explore in detail or explain in detail about why certain things are happening. Now, understanding the role of context in terms of the the barriers or the enablers of uptake of some services, utilization services, or just describing about, people have had faced stigma during COVID-19. We may want to describe the different types of stigma that women or men have faced during the during COVID-19 and why, and what are the implications of it? How has that affected the COVID-19 testing or treatment? So things like that we may want to explain. So we may want to, so there are things that we may want to explore in detail, we may want to explain, we may want to describe. So all these things are actually the ones where, and that actually leads us to the framing of our research questions. Now, coming to the sampling, this is not a probabilistic sampling that we do here. So it's going to be because here it is the idea or the objective is not for generalization of the results. A little tongue twisting with all these anyway. So here what we want is in terms of we want to inform about what the perspectives or the attitude, the behaviors, the experiences of people are. So we want the sample size to be indexed because because probably it's very difficult to have large size and go to people and then talk to people. The restriction is also there in terms of time as well as in terms of the resources which are available, and also in terms of when we do the analysis, we just not have too much of information with garbage in and garbage out. Rather, it's all the more important to have very good information that we have just not yes and no, but we have more to what we have. We are assessing the research topic. The documentation of the measures for the ethical conduct of research, which Dr. Modi mentioned, and also probably the previous speakers also mentioned, is very important here as well. Because here we are also talking about situation where we are, we are talking to people and understanding their life in them. People, and then the anonymization of the data, the confidentiality are things which are more important. One more thing which I wanted to mention here is about data quality. Once we ensure of confidentiality. We ensure about the research, the anonymization of the data, dealing data which is available. I'm sure the respondents would be happy and willing to give your information, which also leads to a better quality of data, right? Now, then deciding on which data collection methods is important, which are
Ma'am, your mic was on mute for a second. Now you can resume.
okay.
There was some network issue.
Okay, so yeah, so I was talking about the sampling strategies and the data collection method, the data quality managed, how the data quality can be ensured. These are things that while reviewing a proposal, we really want things to be in. We want to see what are the research questions, what sampling design, what methodology, what measures that are going to be taken to ensure data quality, how is the large amount of data that is there that will be managed, and the proposed framework for analysis. And one thing which is often mentioned about qualitative is that, how do you ensure that the results are credible? They are trustworthy. So I'll be talking a little about it. So those things have to be, it's good. It's good if we can mention all those in the proposal. So we know that it says that you are actually thinking about having a good proposal, good quality ensured, and then you're going to be thinking about how all these would be ensured while you collect information. And then it's also important to mention about how you would, it's a lot of money that the government, the funders, that said, apart from that, there is also a lot of time that you as an investigator invest in that respondent or the participant actually invest. So and the accountability has to be there. So let's write in the proposal that, these are my plans of dissemination. So it could be through the report. It has to be, it's always good to go back to the community and then speak to them and then give back the results to them, which is also, which can be listed as a method of dissemination, publication, and of course, for what we are doing with this. Ultimately, what do you want out of this? You want people to hear. The program personnel to hear. So you want also the stakeholders to be listening to your results. Now, the different approaches in a qualitative research in public health, majorly we talk about phenomenology, we talk about grounded theory, we talk about case studies, we talk about descriptive studies. I will not go into the details because I don't think the time is enough, but I will just in brief, go through the table and then list upon, what the focus is. So in phenomenology, what we are basically doing is, if somebody wants to understand the lived experiences of people, then they would go for that. If they really want that, they want to come up with some kind of theory or something, which they want to see that, okay, how is gender the reasons for maybe non-utilization of healthcare. If that is something that we want to explore, then probably they could go and then have their research and their data. So there the data is going to drive the theory. So from the data, from the emerging, the data that we collect, they probably can assess that. Case studies is when they want to be exploring in detail and then come up with the descriptions or the way that the people have experienced, and then can provide case studies to support the phenomena, right? And then many of the times there is also the qualitative descriptive approach, which is there, which actually talks about about it's understanding the meanings that people have, what they do, or maybe the experiences people have in terms of accessing services, or maybe stigma, or maybe why they use smokeless tobacco. And then and how are the analysis? So for each of the methods, the types of data, data collection methods are going to be a little different, and also the analysis that we plan may be different. With the objective that someone is just going to describe, someone is going to explain, someone is going to give exploratory, because we don't know much information. So that is the objective of the method. Now, triangulation is something that we want to talk about. Why? Because here we are talking about qualitative and quantitative data. We are not talking about qualitative and quantitative, but we are talking about qualitative and quantitative. It's not an or situation, but it's an and situation. In some cases, as I mentioned, exploratory, it could be just a qualitative. And in cases of mixed methods, it could be a quantitative and qualitative, where we are using two methods to understand a particular aspect. So that could either be triangulation, or it could be an extended explanation of what we are trying to assess. In some cases, we have the data complementing it. So there could be instances where the qualitative data, once the quantitative data is available, we are actually having those information collected through qualitative and how it's happening. We have the what, but we need to understand the how. Now, in some cases, it could also be that it could be something which we are doing as a formative research before or prior to the conduct of a quantitative research to, in fact, generate a hypothesis or maybe guide the development of our tool. These could be also measures which are in place. Can you notice that? So, how much time do I have so that I can just?
About 5 minutes.
5 minutes. Okay. Now, what we do is that, which I just skip through the slides, and then as we, and if there are any queries, I can take it at the end. So that would be helpful. So here, what we need to understand that in the case of quantitative data collection, we know that the tools of data collection are very much important. Here, in the case of qualitative, the tools of data collection are important, but and here what is all is important. The person is the investigator, because perspective of the investigator will determine how the data is collected, what data comes. Beyond that, yes and no, we really need rich information so that in the end of the our research, we have good data which will help us in analyzing, which will inform the research question that we are trying to answer. Okay, and then something which is very important is also because we cannot always be, trusting our own memories. We need to have the digital recorders, and report. We need to be having the notebooks to be documenting whatever it is. And then the data collection technique. So I will. And what are the levels of data collection which are there? Of course, at the community and the individual level, and the different methods which are there are social mapping, observations, interviews, focus group discussions, document reviews. And all these methods, the selection of these methods depends upon what you want and how much information do you want. How that is going to be supporting you. So, for example, in the case of social mapping, see, here is something that we read in terms of the mapping out the points of sale of tobacco. And what we did is, by here, we were trying to assess the availability and accessibility of tobacco. We mapped it on a GIS and then a geographical mapping, here it is, and then we found that there were 347 shops which were there. So it depends upon the objective, what you want to do. Social mapping is also an important technique to build rapport with the community. Observation could be one where, observation, you want to observe the way the client or the respondent or the beneficiary is behaving with or is accessing health services. How is the healthcare provider delivering the services? So you may want to have a checklist and start observing things. So that could be one. It could be, and that would give us insights about both the perspectives from the researcher's perspective as well as from the participant perspective. Then we have the interviews, and the focus group discussion, which also gives us a lot of information about how the data needs to be collected, right? And all these need to be documented in the research proposal. That's what brings to the point that, what why we need to be understanding these methods, and the choice of our methods depends upon our research questions. And so, in case we're not doing a primary research, we can also go for a secondary research and document review, and then assess into how there has been a change in terms of some policy which is done, so that would be in terms of reviewing existing documents that are available. So this is an example of a research done by a colleagues from NIN, where you can see that they have done a document review to understand in the science textbook how much of information is available on nutrition and food. Okay, so I'm skipping this and these slides will be available. I can make this available so you can share it with the participants. I'm also not going into the ethics because we mentioned about this briefly, and since Dr. Mark also did mention, the basic principles remain the same. And I would just stress upon that ethics is also a way of ensuring that there is good data which is collected, the data quality is ensured, and also the point that dissemination of findings to the community is something which we need to be incorporating, we need to be doing, and also incorporating the proposal so that it's there to remind us that yes, this is something which we need to be doing. Given that, how much time do I have? I'm really hungry. I can. Thank you. So, in terms of selection of the qualitative study, so the purpose of the qualitative, for the respondents, how do we select? Here, we are selecting respondents not by the number, but by people who can share information with us, who really have gone through something, so we know that the experiences would enrich, would have, feed into the research questions that we are asking. So then our strategy would be to purposely select our respondents. Now here, that is why we either go for something that is a typical case that we see that, okay, this is something that we want to understand, that these are the kinds of experience people have, or go from the extreme deviant cases. So there could be people who have experience and who have not experienced some kind of a problem by accessing healthcare, or a maximum variation in our samples that we want to ensure. So we want to see that we are not selecting just few pockets of population to understand what their experiences have, but also to see that we are also having people who, say for example, if you are assessing stigma, then we also have people who probably stigmatized due to other reasons. So maybe they come from a rural area, they come from a background which is lower educated, or they do not have access to facilities anyways, so maybe they have much more stigma than the others. And in some cases we also go for homogeneous populations. And focus on discussion, we want people who are similar in their demographic backgrounds. So what is the appropriate sample size? That depends on our research, and that is according to how much we on the tools of data collection that we have, that we decide upon a sample size. So the data quality, apart from the data quality that I mentioned, there are also things that are in terms of data analytic approaches that we need to be putting in the proposal that we have. So when is the qualitative data collection performed? This is just not when all the data has come back. So that is something which we need to be understanding, that it is something which is iterative, that it is not unlike the where we actually wait until everything is collected. Here we are constantly looking at the data and then seeing it, reading it, and then going back to collect information further on that. So we have that, at least that kind of flexibility which the qualitative data allows us. Okay, the types of data that are available are, the textual data which we majorly collect, apart from visual data which of late people have started to collect. So that helps in contextualizing the situation that we are trying to explain. And in the data, also again, the qualitative data is not as simple as quantitative data is, that you sit with all the data which is available, you run the analysis on the S spaces and go. There everything is available. So here we have to be reading, rereading, and seeing what the data is trying to speak. Is the data actually giving us enough information? And then categorizing it, coding that information, putting into themes. and then trying to explain. So that's how we actually, so that is why it is important that we really, when we are taking up a qualitative research, we devote time for it. We pick up situations that we really need to be doing qualitative, inquiry. So here I would, because when we plan, we also need to be mindful that proper training is something which we need to be integrating into the proposal, that yes, this is what we would do so that we get good information which is available, because if we don't have good information, our data or our information means as much. We might not have enough information to support, and it would be just another quantitative data, the data collection or the findings which we get from a quantitative data collection. That is not what we want. Now there are methods, the software which are available apart from doing the reading and reading. So Atlas DI or NDO is something which we have been often using. All this said and done, very good story management and story, but the reading and the rereading and the rereading have to be done by the individual researcher. And here also we could have teams which are doing it, so that there is objectivity which is maintained and the subjectivity is ruled. Now, what are the challenges? Single quality not provide anything for generating evidence, but that's not the case. In fact, there are good studies which have informed policies and programs, and so it depends on the rigor of the research that is conducted that would that the people believe on your research, that this is a credible research and these findings are important. So not necessarily that you do a quantitative research and in fact come up with the findings. And yes, this is a high, as I mentioned, it's a lot of time has to be invested. Although the research that you get, maybe the findings, as you see, maybe less. Trustworthiness of research, which we need to be mindful of, is the credibility of the research. That what is the validity of the data? How much is your? So we talk about external validity and internal validity. Even here, we need to be mindful of these things. We need to be having audit trails. We need to be talking to our respondents and informing them of the findings or what we have understood, what they have said. And then maybe ask the other researchers also to go through our data and see what it is speaking to us. So the data has to speak, and the data has to speak in a credible manner. How much can we depend on our data? What data, if someone else comes and does the data, have we explained it enough? What the context of the data, what the context is, who are the people who collected the information? All these in details have to be there. How much do the data that we've collected confirm to the findings? How much what people said is there actually in the data? How much have we triangulated the information which is available? So all these things are important, and if we mention that this is how we are going to ensure the trustworthiness of our qualitative research, I think the proposal, already people would think that we are thinking about it. We are going to be doing a good research, and we have clear objectives defined, and we have clear conceptual frameworks. So thank you, and I'm happy to take maybe 2 questions according to what.
According to me, but yes.